Do you think your smile could use a little TLC? How about a dose of Dr. M? Dr. Charles Martin joins us this morning with the answer to the big problem dentistry question. Let's talk about big problem dentistry. All right, I'm hoping this isn't, oh, Bill's coming in today and he's a pain.
No.
Is that not the big problem?
No.
Good. Okay.
Right. The big problem dentistry describes a person who says, my mouth is a mess. I'm a disaster. I'm a train wreck. I know my teeth are horrible. I want to do something about it. That happened for many reasons. I mean, they could have been fearful. They just delayed going. They didn't realize it was happening to them.
Neglect.
Yeah. They didn't know who to turn to trust to get this kind of thing fixed.
Right.
So there's a whole number of reasons it can happen, but people do get into big problems.
Yeah, preventive maintenance was ignored.
Preventive maintenance ignored.
So there's lots of things that need to be done.
Or it's been years since I've been in. So the people with big problems are typically the people who have, haven't maintained their teeth. The important thing, though, is that they don't have to wait any longer. Something can be done about it. It can certainly be fixed. And you're doing yourself a favor on many, many levels by getting your big problems fixed, including how long you live and how good you look.
Yeah, we've talked before about just general health.
Yeah.
Your teeth affect your overall health, and so if you've got big problems, then you could actually have some much bigger problems by ignoring your teeth.
Well, we know now that the person who has chronic dental problems, low-grade infections, puts their heart at risk.
Okay, let's talk about the techniques and the technologies and how many dentists can do the kinds of big problem dentistry.
Well, you need someone who's accustomed to putting all these pieces and parts together. Unlike treating one or two teeth at a time, many times in the big problem cases, we're treating all the teeth because everything needs help. And we have to coordinate how the bite works, how the chewing mechanism works. We have to design the smile. One of the things we have in our office is a computer simulation piece of equipment that allows a person to say, well, how am I going to look like when I get finished? And so we actually take a picture and superimpose.
So you actually get a photograph of what it's going to look like, or pretty close to what it's going to look like?
Before we ever start, so they can see.
For those of us who don't have any forward vision, this is a good thing.
When someone's had an unattractive smile for a long time, they've had big problems for a long time, it's hard for them to even imagine how it could be. They can't even see it in their mind's eye. So we help them see it.
All right, well, let's take a look, and we'll take a look at one here.
Yeah.
A big difference here between a much bigger smile on this lady.
Right. A much happier smile, too. Yeah. Complicated case, as most of these big problem cases are. And, she now walks around with a big smile on her face most of the time.
Yeah, this is a case where I'm looking at the photograph, and the before shot is, oh, you're making me smile.
Oh, you're making me smile.
And I don't really want to. It's almost like she's gritting her teeth.
We have to coax a lot of people to give us a smile.
Yeah, and then afterwards, like, hey,
that's right.
I'm happy with this.
Give me a chance. Let me do it.
Well, big problems can be tackled and by the right doctor and not be so big anymore.
Right. Well, two messages. Don't wait, and something can be done about it.
Okay, thank you.